Okay. Hi, everyone. My name is Kennedy Cole, and I'm the outreach coordinator for the Center for Urban and Regional Analysis at The Ohio State University. I'm excited to welcome you to the final webinar in the series Data for Access and Opportunity. This series is co-sponsored by CURA, the Kirwan Center on the Study of Race and Ethnicity, and the Mid-Ohio Regional Planning Commission. Throughout this series, speakers from various fields will discuss how data contributes to a more equitable world. Today, Ayaz Hyder will discuss practice-oriented data analytics and modeling in the health and human services sector through the Community Information Exchange Initiative. Before we introduce Ayaz, I want to mention a few logistical items. If you require closed captioning today, you will find a box at the bottom of the screen labeled with CC. Click the box and select Show Subtitles. This will allow you to view subtitles during the presentation. During the webinar, feel free to submit questions at any time using the Q&A box. We will ask as many of your questions as we can in the last portion of the presentation, and if we do not get to your question, apologies in advance. Chat has been disabled, so please use the Q&A if you have any information to share with the organizers. As you may have seen on our website, this event is approved for one AICP CM credit. To claim your CM credits, log into your My APA account on the APA website and enter the event into your online CM event log. There will be a brief survey at the end of the webinar. If you have time, we encourage you to provide your feedback to improve these events. If you have any additional questions following this event, don't hesitate to email cura@osu.edu. To learn more about Cura's future events or sign up for our monthly newsletter, visit cura.osu.edu. You can learn more about Curwin at curwin.osu.edu and morpc at morpc.org. Now, I'd like to turn things over to Harvey Miller, Director of the Center for Urban and Regional Analysis, who will introduce our speaker.
Okay, thank you very much, Kennedy. Very happy to have you all here today for the final event of our webinar series this semester. And I'm really pleased to introduce Dr. Ayaz Hyder. Dr. Hyder is an associate professor in the College of Public Health and core faculty in the Translational Data Analytics Institute, TDAI, at The Ohio State University. Dr. Hyder received his PhD in modeling pandemics and health disparities at McGill University in Canada and completed postdoctoral training at Yale University and the University of Toronto. He leads the Computational Epidemiology Lab at OSU, where he develops and translates data analytics tools and computational methods into public health practice. He leverages system science and community engagement methods to address complex public health challenges. His work has been funded by the NSF, the NIH, CDC, and several foundations. Recently, Dr. Hyder has partnered with health departments to work on various COVID-19 response efforts, including surveillance, modeling, and mapping vaccine access. And Dr. Hyder is currently on a leave of absence from Ohio State to lead the data and integration efforts for the Community Information Exchange Initiative at Smart Columbus, which is something he'll be talking about today. I'd also like to add on a personal note that when I took over as Cura Director in 2015, Dr. Hyder was one of my first collaborators that I worked with, and we had a wonderful collaboration for several years. And I've always found him to be an excellent collaborator, a first-rate scholar, and a person who really wants to make the world a better place. So I'm really happy to host you today, Ayaz, and I'm looking forward to your eventual return to Ohio State. With that, please, the floor is yours.
Thank you so much, Harvey. It really is great to be back here. And I'm like literally back here because I'm in an office of Cura for this presentation. So I appreciate the opportunity. I want to kick us off with a short video about what is the CIE. But before I do that, I want to explain to you how I explained what a CIE is to my 9-year-old this morning when she asked me, Dad, what do you do for work? She often asks these kinds of questions. And the way I explained it to her is that the CIE is a website where when someone doesn't have enough food to put at their table, they can go on it and find a place where they can get food. When someone is looking for a job or recently was let go from their place of employment, they can go on there and look for a program that would qualify them and keep them on Medicaid as they are looking for jobs. It's also a place where they can go and look for heating assistance, utility assistance, childcare, and all in one place. And their information is only shared with those who they give permission to, and their information is connected to help them get the right services that they need. So that was how I explained it to a 9-year-old. But let me show you a quick video about what this is from the voices of the residents and the community-based organizations and other partners who we have been most fortunate to work with. So let's see, hopefully this works.
What if getting help in Franklin County didn't depend on luck, connections, or knowing the right words to Google?
There's plenty of resources in Franklin County that can help people with their situation, but if you don't know what's out there, you're going to be stuck.
I had always heard that Columbus is resource rich, communication poor.
Living in constant uncertainty of how and when you're going to have your needs met takes such a deep toll.
The support exists, but our systems don't connect. Right now, the people who need the most help are asked to do the most work.
The paperwork, the repetitiveness of things. You're asking me for it here, the next person is asking me the same thing. A lot of times it just sets up a bigger barrier for families trying to navigate to get help.
That's why we're building the Community Information Exchange, or CIE. The CIE is essential social infrastructure, like roads or bridges. But instead of moving traffic, it moves care. It's one connected system that helps people get support faster, without starting over every time.
To me, it's about putting the person in the center. And if we can do that, then we can figure out what are the right solutions, what are the right opportunities to connect people to resources.
The CIE is powered by local agencies, funders, technologists, and residents, working together to design a system that works for everyone in it.
We have to be all in, and that's going to take all of us, the nonprofit, the public sector, the private sector, all working together.
So if we build on what Columbus does best of working together, we're going to be able to realize that future because we're going to be able to take on real challenges.
The CIE is a turning point for residents, for caseworkers, for every organization working to make life better in Franklin County.
And I think this is one of those projects that if we get it right, and I know that we will be something that we're going to look back at and say that I was a part of that changed not just our organizations, but it changed our community.
All right. So today what we're going to talk about is what is the CIE initiative. I'm going to give you an overview of the data and integration activities that I know some of you really, really care about more than the broad strokes that I'll show you in the beginning. And then I'm going to pivot to the role of engaged communities. And those words are chosen specifically for a reason, which I'll go into later. And then I'm going to end with some lessons learned and some of the challenges ahead. And hopefully we'll be out of here by 1 o'clock. So let me begin. What is the CIE initiative? So as you heard, CIE stands for Community Information Exchange. It is a county-wide technology and change management initiative. What those words mean is that it is both a technology platform, which you see at the center of this graphic, and it is a number of other components that come together to enable that technology platform to change the way services are delivered in our county, to change the way that residents access those services, find those services, are provided those services. And so these are the different components of the CIE. One thing I also want to highlight is when we talk about the health and human services sector, we're talking about each of the organizations who do one or more of what is in these circles. We can call these care and support services, But essentially, these are all the breadth of services that human beings need. Some are very basic, such as food, shelter, safety, and others are sometimes um, needed in addition to those things, such as early childhood education, utility assistance, financial literacy. And so this is the ecosystem in which the CIE is working, and you'll see this in the list of partners that we have. The CIE has two primary goals. One is to empower residents to access the support they need faster and easier. And another goal is to make it easier for service providers to provide that whole person, whole family, whole household care faster and better. Some of the caseworkers who you heard from in that video, they have told us time and time again that they're having to enter the same information multiple times. Residents have said to us, why do I have to provide my information at one location and then another location and then another program? And part of the reason is how our current system is set up, how our funding streams are set up, how our reporting requirements are set up. And so the CIE is meant to streamline a lot of those different ways of doing things and really bring that change across these different types of services that you saw that you're seeing on this slide in a streamlined manner. This is a 10-year community infrastructure project. That's another way to say what is the CIE. Between 2019 and 2024, there was a vision planning and research that was going on. COVID is right in there. 2025 is where we have selected a technology vendor. We are co-designing various components of the CIE, standard workflows and processes in the CIE. And then in 2026, next year, is a limited release of the technology to some early adopter partners. I'll share more about that on the next slide. In 2027 would be the full release to the broader community. And in 2028 is when we integrate the CIE with government, state agencies, local health departments, healthcare systems, and others. The focus areas in this first phase of the CIE is really community-based organizations and our county's information and referral resource, which is called 211, which is managed by Lutheran Social Services. Following that phase two are these future adopters that you see on this slide. Now, in our first phase, who are we working with? We've taken a network of network approach where essentially we are focused in on housing, workforce, childcare and early childhood education, and health. Within these four areas, we have identified network leaders such as Community Shelter Board, Action for Children, Mid-Ohio Food Collective. And those network leaders have brought specific organizations to the table to develop some of these, what we're calling coordinated care workflows. Let me give you a quick example of a coordinated care workflow. An individual goes to a job fair. They're able to scan a QR code that takes them to a website from the CIE that asks them for some basic information to make sure that that workforce program is the right one for them. They're going to be eligible. But as they're entering that information about workforce programs, the CIE might recommend additional services that may also be relevant to that individual, based on their answers. They may also qualify for them, but not know that this resource is available. And so this is what one of the caseworkers in that video was saying, is that there's no place right now. And while some could argue that some caseworkers, some care coordinators, community health workers, social workers do have this information, it primarily exists as a binder. The project that Harvey was talking about earlier, one of the things we learned is I sat in plenty of meetings trying to build a directory of behavioral health services in the county and saw those binders firsthand, saw those Rolodexes, saw those business cards firsthand. And so if every sector in the county has one of those binders, or is asking each other, what we end up with is information that is in silos about those services. What happens when a new care coordinator comes on board? Do they have to build that entire Rolodex over 2 years? So one of the first things that the CIE is doing is building a trusted directory, which would be the one directory where where services and information about those services, including availability, including accessibility, including number of beds available at a shelter, number of childcare spots available, are all in one place, in one directory. That same directory then enables those individuals to not only see that if I apply for this, there's a spot available, but the CIE then enables them to apply for that application, to upload their documentation, determine the eligibility for that voucher, and connects them through what's sometimes called a closed loop referral, or what we're calling a service connection to that service provider who makes sure that they are able to receive those services. And one of the coolest things about the CIE is that it gives residents a portal where they can see all the services they've applied for. Now, some of you work in the health and human services space, and you know that many people don't just have housing as a challenge. If they have housing as a challenge, they may also be food insecure. They may also be reskilling in a workforce program, and they may also have childcare needs, right? And so imagine a resident being able to see all the different places that they're getting services from and the status of their applications all in one place, right? And then they're able to identify additional services. But more than that, they're able to see the outcome. So if you're a caseworker or a community health worker or a care coordinator, you're able to see the status of those things and maybe nudge that organization to move faster, to communicate with other caseworkers on the application of your client who may not have provided certain pieces of information all in one place. And you're able to then do this in a mobile app or on a website or on a tablet very easily and in the least number of clicks. And so this is what the CIE is trying to enable. And I'm going to spend the next couple of slides talking about some of the details behind the scenes. But this quote is really what we have taken to heart, that life is too short to build something nobody wants. And so we're building this work with a human-centered design methods and research in mind, with community engagement best practices, and engaging with a wide range of stakeholders, including all the 4 hospital systems who we have engaged regularly throughout this process, even though we're not bringing them on board until 2028. For those of you who have worked in anything related to health or healthcare, you know how long it takes to get some of these integrations built. And so that is what we're doing. And we're doing this with our partners. So the CIE is funded by the Franklin County Board of Commissioners, by the City of Columbus, and we are in doing this work in partnership with the Rise Together Innovation Institute, and Smart Columbus is the anchor organization for this work. You see our partners listed here. They really are the who, the who's who of the health and human services sector. And if you want a longer list of who we have engaged in various capacities, you can see this list over here. So with that, I'm going to give you an overview of some of the data and integration activities in the CIE. Just to make sure how am I doing on time. Okay, time's good. So I want to kick this section off with two quick quotes. One is that data are a strategic asset of the health and human services sector, yet data are not treated as such in the sector. Okay. And another saying which I came up with, so I attribute this to myself, is data without action is wastefulness, and action without data is foolishness. I've gotten in trouble for saying this in front of audiences sometimes because I've even said, hey, maybe don't share your data with that department or that agency if they're not going to give it back to you in a way that you can act on it, right? So let me give you an idea of how I'm um, uh, since I've been at Smart Columbus, what kinds of things I've been fortunate to do to address some of the implications of these two statements. So as I showed you earlier in that diagram with the CIE technology platform in the middle, some of the other components of that are a data sharing framework and informed community insights. The best way to think about these two components is that the data sharing framework is what allows individuals to share their data who are using the CIE looking for services, or when a 211 call specialist is helping individuals find resources. There's a sharing of data happening, and there's lots of data that's being shared. So we need policies, procedures, and agreements. We need data management plans. We need data governance policies. We need consent frameworks. And I've been working diligently on that over the last year and a half at Smart Columbus. The other component of data sharing is that community-based organizations do not have the capacity to share data externally. And even internally, sometimes their capacity is limited. There are many reasons for this. And I'll share with you a report that you can read all about what these reasons are. But we need to, as a CIE initiative, as part of the CIE initiative, we can't just say, hey, share your data. And if you can't share it, too bad, you can't participate. No. I come from a public health background, and so the core value in public health of equity has been drilled into me and into my DNA, since day one. And so equitable data sharing, equitable access to resources to build that data sharing capacity has been a key focus of mine in the work that I've been doing at the CIA. And you'll see some examples of that in just a little bit. Okay, so that's data sharing framework. Informed community insights is the translation of all the data that we're talking about that's linked across housing, childcare, workforce, health, and many other sectors. How do we link those data using probabilistic data linkage methods, using some other data standards? How do we link that? And then how do we prioritize use cases that are coming from the community-based organizations? And these have varied from folks asking us, where are the human service deserts? Okay. Another example is that if we link data across certain systems, can the CIE be that neutral body that stores that linked information, right? Because many organizations do not have the capacity to link data across systems. And I'll give you a quick example. The Community Shelter Board, which is the continuum of care in our county, where the Department of Housing and Urban Development monies come down and they distribute it to different housing initiatives, including emergency shelters. They have a system called HMIS that is used to store data in a standardized format. Okay, the food pantries have their own data and they have their own systems. The Columbus Metropolitan Housing Authority has their own data Our school systems have their own data systems. Our public health departments have their own data systems. So how do we link data across these systems? And then what are the questions we can ask if when those data are linked is what is going to be now possible with the CIE. Another focus of these informed community insights is program and service operations research. And that is specifically focused on the needs of the community, of the community-based organizations. So one of the questions they've asked us is, how do we know where are the gaps in service delivery? Like, we can measure things in our own system that we're funding, but the people we're serving are also going to all these other organizations, and we don't know what they're getting from there. Okay, so if the CIE is that one place where your data is linked between health and human services, then we can identify who is doing service delivery and where are those gaps. And where are the ways to invest in efficiencies across the sector? Okay, because does it make sense for one person to have to go to three different places to get three different services, not knowing that if we co-located, if we redesigned the availability of these services, co-located services in certain places, we could deliver those services more efficiently, right? And to support all of this, we need an analytics and model development environment where we need ontologies, we need data commons, we need model commons, we need AI and other tools to be able to facilitate this work. And so this really is a huge piece of this work that we're starting to build in small pieces. So let me give you a quick example of what data and integration activities have been launched or completed to date in the CIE initiative. So the first one is that we launched a data and innovation group in health and human services. Essentially, this is a data leaders group. And when I started this work, I realized that there are many folks in the health and human services sector who are thinking innovatively about the use of data within their own systems, within their own organization, but they don't have a place where they can find other like-minded people who also have ideas, who also want to do innovative things. And so we brought this data leaders group. It meets every quarter, and we have our quarterly meeting next week, and we have over 17 organizations in this work, and we have a lot of fun doing this work. This group has come together to publish a couple of reports and toolkits on data sharing and data policy that I'll talk a little bit more about in a second. We've also completed data capability assessments with over 10 organizations to get an idea of what are the capabilities that we have to build. We've also developed use cases for analytics and modeling in the housing sector, and we're partnering with behavioral health, maternal and child health, early childhood education programs, and initiatives on data integration, creating longitudinal records, linked data, and outcomes reporting. Now, if you're a researcher listening to this and you're like, hold on, we have this data in our own backyard. When can I access it? What can I do with it? When can I submit that R1 grant, R01 grant to NIH for this? Well, hold on. We're building the infrastructure right now so that we can have this data available. Sometimes these linked data, like the All of Us initiative at NIH, exist, but at the federal level. They're not local enough, right? And sometimes they rely mainly on administrative data, which is what the government collects, but those do not have some of these data from the nonprofit sector and the other health and human services sectors. And so that's what's unique about this work is that we're integrating the data, we're bringing it together and doing it in a thoughtful way with privacy and data security and resident trust all at the center. That's the starting point. The Data and Innovation Leaders Group, I think these slides will be shared afterwards. I'm not going to read the whole thing, But really, one of their goals is to convene, lead, and innovate and partner to support the building and sustainable use of the CIE and related efforts. These are the thematic areas, the four themes or objectives, and then specifically sub-objectives that we've been working towards. And we have a number of things that we have done across some of these. One of those things is a data strategy. I'm not going to go through it, but I'll show you some examples of what that data strategy looks like. Another thing that we have released recently is a data sharing gaps and recommendation report. What's really cool about this report is that it is based on online surveys and focus groups with local partners right here in Franklin County. So they have told us what are the gaps that prevent them from sharing data. And they range from the skill sets, the knowledge and tools, all the way to the lack of funding or just not even knowing where to start. So you can read this report. It's if you click on this slide, this link, it'll take you there. We've also developed a shared language and standardized data protocols toolkit to help organizations assess their readiness for data exchange and participation in the CIE. Here's an example of some of the questions that we had in that data sharing gaps and recommendations report with some quotes. So what you can see is that we've covered a wide range of sectors, and we have some really good data about what's going on locally. Where are there opportunities for improvement? Here's an example of the 8 priorities that came out in the data strategy for health and human services in Franklin County and Columbus, Ohio. The full report is available on that website. But what you see across these priorities is that these are very high level. And that's on purpose because what the data leaders group told us when we gave them this space to share what are their priorities, it allowed us to look at treat data as a strategic asset in a very holistic manner. So we can go from the data infrastructure all the way to training needs. And anybody who teaches data analytics, here's your call for helping train the nonprofit sector in the use of data tools, to data quality, improving systems, tracking measurable outcomes, ethical data practices, community education, and centering the needs of community and populations who are facing barriers. So what I'm showing you on this slide this is not meant for you to read, but to illustrate that these priorities have specific initiatives underneath each of them. And underneath each initiative are goals and key actions that can be done to achieve or to back up that initiative, to do that initiative in order to achieve that priority. So like this is how things go back up. And this is not developed by Smart Columbus. This is developed by a smaller group of folks who came together, spent months with us in coming up with these priorities, initiatives underneath each priority, and key actions. And so this is the work that's now guiding the investments, guiding the decision making in the health and human services sector. And we do have some work to socialize this continually, but within the partners that you saw earlier, they're all the ones who developed this. Here's another example of some of the initiatives and key actions under promoting ethical data practices and centering the community and vulnerable populations. So that gives you an overview of where we are in the data and integration activities. Things that I didn't talk about that we're working on a regular basis are things like master person indices, things like chatbots that are for the health and human services sector. But we need taxonomies that are aligned with this work. We need to develop ontologies. We need to do a lot of different things. And that is where we're hoping that there will be partnerships, maybe with some of you going forward to offer that expertise. I want to talk about what data are being collected in the CIE initiative. And then switch over to how we're translating those data into action. Okay. So the data that are kept up to date, secure, help to improve collaboration and enhance outcomes and provide easier engagement for all. What that means is that the data is the glue that helps service providers and residents do what they do best and focus on that care coordination, that listening, that interaction, that community that they're in, rather than worrying about, spending time on entering forms again and again and again, trying to upload documents in multiple places all the time, trying to like repeating your story. Like, can you imagine how traumatic it is for someone who shows up at a domestic violence shelter and does the intake form and then has to repeat some parts of that same information again if they go to a behavioral health provider or if they go to for looking for heating assistance? Like, why can't they say their information once and all these providers get their act together and just it should work, right? It should just work. And so that is what the CIE is trying to do, is to provide that environment, that infrastructure, and the human resources and the funding to make that happen. Residents should be able to access their data in a comprehensive manner and in equitable manner. So one of the things that I didn't talk about is how are we ensuring residents and caseworkers can equitably access the CIE. So we have plans to stand up what are called CIE navigation centers. These are physical locations that you can go to in the county and access the platform. But also we're working directly with those agencies who have case management systems to build those integrations on the back end when those case management systems exist, to be able to send the referral or send the information into their existing case management systems so that they're not having to log into another platform just to do their job, right? So we've taken this very seriously and we picked a vendor that has those capabilities. For service providers, the easier access they can have to data and only the data that they need. So we have this concept in the CIE of profile incremental progressive profile data profile. And what that means is that if you've come into a place and you have no intention of applying for housing assistance, why should we ask you questions about housing? Right? If you come into a location and you know exactly what you want, you should be able to answer those questions that get you to your needs faster, as opposed to asking like 50 questions that you don't have time for. You're anxious, you're in crisis. And so we're taking this very seriously by making sure that we have shared language among providers where they are able to assess things like crisis, things like when you're going from okay, not okay to okay, appropriately, and then you're asking the right questions and only what you need to ask. I want to give you a perspective of the CIE on what it means, what is an engaged community. We have on the left, you'll see a number of different things that the CIE is doing. We have a care coordination council, an experience council of residents and caseworkers who we've engaged with over 2 years. We're actually doing an audit of our equity practices led by the Kerwin Institute. We have a care coordination summit that goes on regularly. But an engaged community is a group of individuals that is directly or indirectly affected by a data or model-based solution or technology-based solution, such as the CIE, and it is taking a leading role in conceptualizing, developing, testing, implementing, evaluating, revising, and sustaining the solution to a problem, issue, or challenge. In other words, my personal or my scholarship, has shown time and time again that when we do community engagement, there's a power dynamic. There's that the community is being engaged. I want to flip that by saying that we need engaged communities where, yes, they might need some information to become engaged, but really in the long term, when they're an engaged community, these solutions, these tech solutions that we're thinking, these change management solutions, these policy solutions we're thinking about are bound to last much longer and actually solve the problem if those communities are involved from the beginning to the end of conceptualizing to implementing and sustaining that solution. I'm going to quickly go over the lessons learned so that we have enough time for any questions you may have. There are many, many lessons and we're still learning, okay? I'm not going to go through all of these except to say that just maybe touch on some of these. So let's see, which one do I want to touch on? Okay, I'm going to talk about the first one. So keeping pace with the community and stakeholders is hard but doable. As you all know, in the current funding climate based on federal, state, and city, what's going on in our community, the off-the-cuff remarks that sometimes set off a chain reaction in certain communities. These are challenges that the Health and Human Services community is dealing with on a daily basis. No organization that I've talked to or I've been told is immune or not affected by what's happening. And so we are doing our best to keep pace with when the community, when stakeholders are available, are accessible to answer some of these questions and build the CIE with us. I also want to talk about some of the challenges ahead. In the CIE, we are talking about people, process, policy, technology, and data. We know that they are all connected all the time in a CIE-like effort. For example, the CIE is thinking, the CIE needs to have standards. Well, how do we go across multiple sectors to set those standards, right, in a short period of time? Smart Columbus can't do it all. And so we are starting to explore what a university community partnership model might look like because we're not experts in a chatbot, but some of you might be, or you might know someone who is. We're not experts in GIS. I know Harvey is. We're not experts in equity practices, but Kerwin is. So how can we leverage the land grant mission of Ohio State, but also other universities in our community to do this work together for the benefit of all the residents in Franklin County and Central Ohio. And so with that, I want to thank you for listening and look forward to any questions you have. And feel free to reach out to me by email or visit the website for any additional information. There's a lot more there that you can use to learn about this. And once again, thank you to Cura, MORPC, and the Kerwin Institute for sponsoring this webinar.
And thank you, Ayaz. That was a really impressive presentation. You know, very difficult project, clearly, but clearly the impact can be huge. So we wish you the best of luck. And I want to remind the audience that we have, ask your questions in the Q&A box, and we'll get to them as soon as I start off with a couple questions from the moderator. And so keep those questions coming. So one question that comes to mind, thinking about the impact of this project, you mentioned that the CIE wants to improve health, well-being, and equity through data sharing and integration. What measurable outcomes or success indicators do you foresee over the next, let's say, 3 to 5 years and beyond?
Yeah. What we're doing is that we're staying in our lane when it comes to those topics. And what I mean by that is the CIE is not a direct service provider. They're not a healthcare provider. They don't provide housing. They don't provide childcare. So we're working with the funding and the coordinating organizations who do provide those services, who do want those outcomes to be tracked and be measurable. For example, recently at the Community Health Improvement Plan meeting, their metrics for their next 2026-2029 Community Health Improvement Plan, the metrics they're tracking they've asked this, they've ranked the CIE as one of the most important things that are going to be needed so that we can measure those metrics in a standardized way and measure them in more near real time as opposed to how we're currently measuring them. And so to me, that would be a success for us if we're able to um, create this platform in a way that the decision makers in the county and the city and townships and villages can use this information to make better decisions, to make decisions faster, to build that resilience and that adaptive capacity that I think our community deserves and is long overdue. And if we had a CIE during the COVID-19 pandemic response efforts, you can imagine how simpler and easier and faster some of those things would have been. So that's how
Right.
we're working on that.
Are you doing any usability testing to see how well this information exchange can help people navigate these services and acquire them?
Absolutely. Every day we use human-centered design to keep an eye on that and make sure that the primary end users of this work are the residents and the caseworkers. And if they can't use it and if they fall through a crack, we're making sure that there would be no dead ends, that even
Right.
if you are coming in, you're able to look for information anonymously. And if you choose to create an account, you can create an account and see your information in one place. So we're making sure that we're centering the needs of residents and CBOs every single day.
Good. Yeah, I would expect that, but I had to ask. Um, so related question is surrounds engagement. I know, I run a center that does community engagement. It can be very challenging.
Yeah.
So, you've emphasized the role of engaged communities conceptualizing and sustaining these solutions. So what strategies have you found to be the most effective in ensuring meaningful participation and consent in this engagement process?
Yeah. I think it's the first step is being very real and not waving your hand at some of these challenges and calling out challenges that are a challenge. So, for example, the CIE is in a unique position to be that neutral convener sometimes of things that don't get said in certain rooms, right?
Hmm.
And I
Hmm.
think what that helps us is translate words and speed things up sometimes when people just don't have the capacity to do it. So you can imagine in the health and human services sector when some of them are at risk of actually not being even in the county next year. Like I've heard this directly from the Human Services Chamber. Some are not going to make it. So what do we do? And as we build this for the small CBOs, where the executive director is the IT manager, is the PR person, is the one making all the decisions, and is also the person opening the doors in the morning and the last person to leave at night. Versus the big ones who have amazing IT infrastructure, have an EHR, have all these other things. So the CIE has to work for everybody, and we have to make sure that the engaged communities have an equal opportunity to have their voice heard as we design this, because we have an opportunity to design something right now, and it has to work for the 13-year-old child who's helping their parents translate things into English, because they have to be able to log on to the
Hmm.
CIE just as much as the 80-year-old who is looking for places to get, their heating
Right.
turned back on, and everybody in between.
Oh, just a quick follow-up, then I'm going to turn it over to Kennedy to handle some of the audience questions. Um, how are you reaching these communities where they live? Because
Mhm.
some of these communities you're describing are very, very hard to reach.
Yes.
They're living under a lot of stress. They have a lot of
Yes.
things on their plate. They don't have time to come to meetings
Right.
and talk
Right.
to you. So what are you doing in that regard?
Yeah. One of the things we're doing is we have about 2 years ago, we set up a CIE experience councils. These are 13 caseworkers and 13 residents from multiple backgrounds, multiple demographics, ethnicities, lived experiences, socioeconomic status, who have been advising us every 2 months. They come to the Smart Columbus Experience Center. They are paid for their time, their entire time they're there. They have any needs like childcare, those are paid for. Transportation is paid for by us. And they're the ones who we are taking our orders from. You know, we don't do anything that isn't approved by the Care Coordination Council, which is representatives from over 40 CBOs who are at the table, who meet every 2 months, who tell us what we're doing right, what we're doing wrong, what we need to improve on. And so we've tried we're working with in a number of different ways to do this. I'll also mention that the concept of a CIE exists across the US in many other communities. San Diego has one that's about 10 years, 15 years old. Rochester's got one that's about 7 years old. Austin's got one that's a couple years old. St. Louis. Now in Ohio, there's also one that's in Cincinnati, in Toledo that's coming up, and in Akron that's there. So we have this learning that we share with the national CIE movement on engaging communities, on centering their needs. So we're doing that learning, but also adapting it to local approaches, keeping in mind our community.
Okay, thank you. I'm going to turn over to Kennedy now. There's some audience questions that she'll be fielding.
Yeah, thank you so much, Harvey. And thank you, Professor Hyder. That was an amazing presentation. We have a few questions in the Q&A, but also Jordan Linton Cox, who is the Associate Director of Research at CureWin, she actually has a question and she wasn't able to put it in the Q&A, so I'm going to ask on her behalf. So let me read this. First of all, she wants to thank you for allowing CureWin to be a partner on the project. And then here's her question. Are there examples of similar structures or models in other cities that you have used to develop the CIE? And can you share a little more about the background of the concept?
Sure. The concept of the CIE started in San Diego, California, about 10, 15 years ago, where they were finding that individuals who were coming into their community shelter board system were often also going to the food pantry, were also often going to the emergency department, were also going to other services before they showed up there. And so with the epidemic of unhoused individuals in San Diego, they started to look at how can we connect the data in the health and human services sector as opposed to healthcare. Healthcare's got a very good job, relatively speaking, of connecting data, but not so much in the health and human services. So that's where the concept emerged. And now they actually run their health information exchange as well as their CIE in the San Diego region. So they're really like ahead of the curve. So I attend some of the national meetings of the CIE across the US. We make sure that we are learning from them on a regular basis. We consult with other CIEs on a regular basis to see what's working in your community, what didn't work. For example, Section 1115 waivers have been used in a couple of communities from the Center for Medicare and Medicaid Services. And we don't have one here in Ohio, but they have used those to connect the social determinants of health and the healthcare data better to do some of their work. And so we are continuously learning, and we actually hosted a statewide CIE convening in October. We took the leadership on that and convened many partners from state agencies to other state initiatives to bring them together and say, hey, we're all doing this work together. We're going to have needs that we need to go to state agencies with together, maybe, or funders together. How can we work together? So that has been critical. And then the work with Rise Together initiative has been amazing because they are providing us the voice of the communities that they work with. So they're our thought partner. They're our partner on the ground on a regular basis in a lot of the work that we're doing.
Thank you. And that kind of actually answers one of the other questions we had in the Q&A. So let me look at one of the other questions. Someone asked, regarding the plan to have AI-enabled care coordination and referral services, how does the CIE plan to collaborate with existing services that may have some overlap? For example, Unite Us, closed loop referral system.
Sure. So we have spent, I can't count the number of meetings in my head now, with multiple state agencies understanding what the state systems are doing and where they're going with their technology, especially in the health and human services space. And our goal there has been to brief them on what the CIE is. We've actually had meetings with some state legislators who are very interested in what the CIE is doing. And they've had the same question is like, how do you coordinate with others? So one of the things we're doing is, look, I really believe like if something isn't broken, don't fix it, right? And also, one thing that was drilled into me with past projects that I've done in the county is that duplication of effort never benefits anybody. Okay. So you have to figure out creative ways to make things easier for the caseworker, for the resident. And so if existing services do exist already and they're working well for someone, they should keep using them. They should know what we're doing, and it's their choice what they want to do. Um, but at the end of the day, we're not forcing anyone to be on the CIE. If someone sees value in being part of the CIE, we have examples of what those value propositions are, and they can incorporate. For example, we know that in the county, there are existing like care coordination efforts. When we put out an RFP, we said, you have to integrate with this case management system because multiple organizations use it. We didn't budge on that because we know how important it is for allowing the end user to do what they need to do and not get bogged down with like another system to enter information. And we will do the hard work that's needed to do those mappings, to do those integrations, so that at the end of the day, the lives of others are easier. And I think we owe ourselves to do that because we have that skill set to do that.
Thank you for answering that question. And you've done a great job your entire presentation, um, explaining something that is kind of, this initiative, like Harvey had mentioned previously, has a lot of components to it. Um, but it's so important, and you explained it so well, and you simplified it very well, especially for someone like me.
Thank
So
you.
that was great. Since it's 12:57 now, I'm going to hand it over to Harvey for closing, but thank you so much for your presentation.
Thank you.
Yes, thank you. I want to underscore what Kennedy just said. That was a very clear presentation and compelling presentation, again, on a big complicated project that could be very impactful. So again, thank you for that. Okay, so that concludes our webinar series for fall 2025. Our next webinar series in spring 2026 will be on the topic of cities for all, creating communities that can be enjoyed by everyone. Now, in this webinar series in the spring, we will discuss how cities can approach urban planning in a way that prioritizes serving the diverse needs of residents. And specifically, we're going to be looking at groups which have often been overlooked in planning processes. In particular, women, children, older adults, and individuals with disabilities. Our first event in that webinar series will take place Friday, January 16th from 12 to 1 Eastern Time. And we're pleased to be hosting Dr. Leah Ravensbergen from the School of Earth Environment Society, at McMaster University in Canada, and she will speak on gender mainstreaming transportation planning. And again, that will be January 16th from 12 to 1. I also want to announce a special live event for next semester. This will be January 27th. We are hosting Sarah Goodyear and Doug Gordon from the acclaimed podcast, The War on Cars. They will join us for a live discussion at the Wexner Center for the Arts to discuss their new book, Life After Cars. This conversation will focus on the future of urban life and how transportation, housing, and climate advocacy can intersect to create more livable, people-centered communities. There'll be a live presentation, a panel discussion, and Q&A, and a book signing for the event. This will be at the Wexner Center for the Arts in the evening, Tuesday, January 27th, from 6:30 to 8. So if you go to cura.osu.edu and look under outreach, you'll see a link to this event, and you can see about ticket information. And also you'll see the first postings of our Cities for All webinar series for next semester. So we hope to see you online next semester. And for those of you in Columbus, we hope to see you at the Wexner Center for this very exciting special event on life after cars. Okay, with that, we are done for this semester, and I want to thank you all for joining us. Have a great weekend, have a great holiday season, and best wishes to everyone for the new year. Thank you very much.